Hello, my name is Aileen Beattie. I'm the clinical lead for the Behaviour Support Service within psychiatry. Shared purpose is our commitment as a trust to provide compassionate, dignified and respectful care for older people. The focus is on creating a culture of compassion, improving patient experience and educating and supporting staff.
Hello, my name is Kelly Angus and I'm Deputy Director of Human Resources at Northumbria Healthcare NHS Foundation Trust. A lot of work has been done based on shared purpose, which is aligned to the values of the organisation and aligned to the values of the NHS Constitution. Notably, values-based recruitment and having values embedded throughout the employee journey in the organisation is a key aspect of this work. Appraisal is now values-based. We've had over 500 managers trained in values-based recruitment. Values really are at the heart of our organisation.
Hello, my name is Emma Dawes and I'm the Matron for Practice Development here at Northumbria Healthcare. The two-day Learning About the Person course invites multidisciplinary teams to learn and develop together. The teaching is delivered by a specialist clinical lecturer practitioner and other clinical specialists in dementia care. Day 1 explores person-centred care and allows participants to really understand what it's like to live with dementia and the impact it has on the person and those who care for them. Day 2 looks at what we can do differently here at Northumbria Healthcare and covers a range of practical sessions including communication, managing behaviour that challenges, assessing and managing pain, cognitive testing and how we can improve the care environment to make it more dementia friendly. This course has had a real impact on our staff and patients. Many of our staff describe a light bulb moment during the course where they suddenly realise how they've been getting things wrong and what it is that they need to do differently. Some of the improvements that we've made for patients are really quite tangible. For example, many areas have redecorated their day room to create a dementia-friendly environment. They've put up clocks with dates and times on and introduced coloured crockery. Other improvements are much less tangible and they come from how we empower staff to make a difference. One example is a nursing assistant who was helping a person get dressed in the morning. The person was becoming very agitated and distressed and the nursing assistant was observed to step back, get down on their knees, hold the patient's hand, make eye contact and take the time to really explain what was happening and allow the person to do as much as they can.
My name is Sarah and I work as a nursing assistant here on critical care and I also work with the patients out on the wards as a rehabilitation assistant. Yeah, I feel like I've made a real difference, certainly one patient in particular. We sadly had a lady who was coming to the end of her life here on critical care. She had said to us that she was never going to be able to wear her wedding dress. This lady was due to be married in the following summer. So the next day I knew through a previous patient that a wedding could be performed on a critical care unit. So when I went home I thought about that, come back, planted the seed to the matron, and it was from there that we then got in touch with the chaplain, got in touch with our family. So by 5 o'clock that day the lady was married down in the chapel and it was absolutely lovely. It was, sad but lovely at the same time to be able to grant that wish.
My name's Michael Porter and I'm a nutrition assistant on Ward 23. One instance where I felt as if I really made a difference was a lady, she didn't eat a lot, she was really struggling. Our son had brought her a box of chocolates in and I noticed she left one chocolate in the box. So what I done was I asked the reason why she wasn't eating that chocolate. It's because she didn't want the box to end because it was for my son. So I kept on filling the box up and told her not to worry because I would continue to fill the box up So it was kind of a never-ending box of chocolates, and it made us smile.
Hello, my name's Jo McIntosh and I am a Service Improvement Project Manager in the Patient Experience team. We are continually working to improve the experience of our patients, but also I feel that what we recognise and what we also do is that we work extremely hard to improve the experience of our staff. When you look at the evidence, the links between the experience of patients and NHS staff, for those to be positive, the two are linked and you can't separate that. So it is important that when you're working on projects that you can involve staff, you engage with them, you consult with them and you listen to their ideas and ultimately work together as a team. What is it that I love about working in Northumbria is the fact that it actually means that I enjoy coming to work every day. It means that I'm able to do the job that fits with me, my values, my behaviours and what I want to achieve for myself in terms for improving things for patients, improving things for my work colleagues, so ensuring that the staff that work in our organisation have a good experience, because that's just as important as patients.
Goodbye Piccadilly, farewell Leicester Square. It's a long, long way to Tipperary, but my heart's right there into wish me.
Hello, my name's Jade Little and I'm a healthcare apprentice on Ward 23. The best thing about being a healthcare apprentice on Ward 23 is having direct contact with the patients every day.
What makes the care better? Well, they're all so friendly and polite and nice, and if you ask them to do anything, they do it. It's absolutely marvellous. I couldn't want anything better.
Hi, I'm Annie. I'm Director of Patient Experience within the Trust. It's a great privilege to be in my role, really. The Trust over a number of years now have developed a really comprehensive way of listening and really understanding what patients think about their care. And what it involves is measuring well and measuring often. We want to speak to lots of patients and capture their views at lots of different points in their care. Measuring patient experience is really important because what we know is that how patients feel about their care, their rating of experience, is directly linked to the safety of care too. So it's really important as an organisation that we get reliable information and that we act on it quickly.
Hello, my name's Rachel Healy and I'm the Ward Manager of Ambulatory Care and Short Stay at the new Northumbria Hospital. Feedback from patients about their experience within my unit allows us to improve the service that we provide to patients. It also allows us to know that we're getting the service right and that the service is of high standard and safe. And if we're not providing that, it allows engagement with patients for us to understand exactly what it is that they want and how we can provide that for them to improve the care that we give to them.
Hello, my name is David Evans and I'm the Medical Director of the Trust. It's vitally important that consultants get feedback from patients. That's how they know the quality of the care that they're giving and what their patients think of them. It also has an important role in their annual appraisal, the way we review their performance. It's a key part of that discussion, and also the General Medical Council every 5 years for revalidation purposes requires that patient feedback is a key part of that assessment.
Staff experience is the same but slightly different than patient experience because for staff they're here to provide ultimately an excellent service. Patient experience allows staff to realise that they're providing that, and if they haven't provided that, how they can improve and how they can become more confident in improving and engaging with patients to provide a safe and quality care.
The link between staff experience and patient experience is really worth paying attention to. We know from the evidence that if what you want is safe, compassionate and dignified care for your patients, then what you have to do is support your staff so that they feel supported and safe in their roles and that the relationships they have with colleagues are dignified and respectful too.
Hello, my name is Michael Taylor. I'm Portering and Security Manager for Northumbria Healthcare Trust, and previously my job title was Catering Manager for the Trust. We improved nutrition by producing some picture menus to help patients choose the food that they wanted. It was found out by the nutritional nurses that the patients always picked the last thing that was said by the nurse. So the picture menus were brought to the forefront as being an excellent idea to show that people a picture of the food that was on offer. The impact's been quite high because we're seeing less waste on the plate, which means that the patient is eating a lot more, and that means the recovery time should be reduced because of the nutrients they're getting into the body.
And the food is excellent. Today I said, you can make it full. It was coronation chicken. It was beautiful. Just gorgeous.
Hello, my name is Bev Banks. I'm a ward manager of Ward 3 at North Tyneside General. Age UK have been involved on the ward through shared purpose. They have come and they have looked at us very closely. The feedback was very, very good. There were obviously things that we could improve, and that's what we've done, and we've taken that on board and we've changed things quite quickly. You might notice on the ward, it's not white, it's not clinical. The colours are very relaxing, and the way that we've got the colours help different kinds of patients that we have with different cognitive issues, and we get a lot of feedback from relatives to say that in this environment the relatives settle very, very quickly, much more so than in a clinical area. We have different areas for different kinds of patients that we have on the ward, and it improves their physical and mental well-being whilst they're on the ward.
Hello, my name is Fiona Gay. I am the Shared Purpose Project Manager within Northumbria Healthcare. So the thing that I've loved most about being part of Shared Purpose is having the opportunity to find the joy in improvement, being able to shine a light on the little things that staff do every day, and to unearth stories of compassion and kindness.
Hi, I'm Matt Brown. I'm one of the general managers here at Northumbria. As a manager, I think the thing that I love most about Northumbria is the level of relationship that we managers have with the clinical teams. So we work really, really together with all of our clinicians. It feels as though we're very much in partnership, working towards a shared goal of making things better for our patients, and that feels fantastic.
Hello, my name's Mary Wilson and I'm a volunteer at the Trust here. What I love about the job is at this hospital, the new hospital, I'm on meet and greet, so I see a variety of people coming through the door and hopefully point them in the right direction. I feel very proud to work for Northumbria Healthcare. It's a great trust, and this is a great hospital to work in.
The culture in this organisation is something that makes you feel that it's a can-do. I think that is fostered by the people who work here.
Through shared purpose, I feel as if I'm valued and I'm listened to.
It makes me feel really proud knowing that I get patients home well and better. For example, if they're coming on a full body hoist and we help to get them home walking again.
I'm proud to be here and proud to be a manager of this unit because I have amazing staff and really good engagement with patients, and I think that allows us to improve constantly and provide the best and be the best that we could possibly be.
I'm really proud of the HR contribution to the Shared Purpose project, embedding our values in the organisation. It really is pride in everything that we do.
I'm really proud of what we've achieved through Shared Purpose. The education programme in particular, the 2-day course, gives staff an opportunity to reflect on their practice, to have time out of the ward, to show that we value them, and actually they do go back and make big changes in the ward environment.
I love my job here because being able to make that difference for patients, being able to make wishes come true.
I'm really proud that Northumbria Healthcare has recognised the value of this course and is continuing to fund it in the future.
I'm proud to work for Northumbria because of the fantastic teams that we have, the way in which our patients believe they get good care, and the fact that our staff enjoy working for us.
I feel really proud to work for Northumbria because I feel really valued as a member of staff, and I see it as an organisation that does love its values and that places a lot of importance on feedback from our staff and feedback from our patients, and really does want to continually improve.
I'm very proud to be part of this organisation. I've been part of the Northumbria for a long time, more than 20 years, so clearly I like it here. I believe it's truly focused on the things that matter, truly focused on improving care for patients and improving care for staff, and that commitment feels very real.